The top stories tonight in Y News. The Department of Health has started augmenting health workers after several hospitals in Metro Manila reached their full capacity.
The palace opposes calls from senators to abolish the interagency task force for the management of emerging infectious diseases over the rising COVID-19 cases in the country.
The Department of Health has started its investigation on reports of several local chief executives receiving COVID-19 vaccines. Chinese vessels remain situated at the Julian Felipe Reef in the West Philippine Sea, despite warnings and a diplomatic protest against China.
A whistleblower claims that the group behind the trafficking scheme of Filipino women in Syria is the same syndicate behind the Pastilla scam.
And at least 10 people were killed after a shooting incident at a grocery store in Colorado, USA. Good evening, Philippines and the world. Today is Tuesday, March 23, 2021. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. The Marikina City local government plans to further strengthen its hospital referral system. Meanwhile, in San Juan City, more quarantine facilities are soon to be opened. Janice Inhenta reports why.
Hospitals in Marikina City are now operating beyond its full capacity, with patients being referred to other medical facilities. Marikina City Mayor Marcelino Teodoro said Marikina City has recorded a 200% increase in coronavirus infections. With this, the LGU plans to strengthen their hospital referral system to avoid congestion as cases continues to rise.
Nasa full capacity na tayo sa mga hospital natin. Kaya kinakausap natin sila na kung po pwede magkaroon ng adjustment. Kaya cooperative naman ang mga private hospital natin dahil nakikita nila dito sa surge na nangyayari. We need to be united. Kailangan magkaisa ang buong healthcare workers community.
Mayor Teodoro recognized the cooperation of some private hospitals in the city where some COVID-19 patients were referred.
Para sa ganon, yung mga non-COVID patients natin ay hindi na makipag-tiksikan pa sa mga COVID referral hospital natin. Kundi sila ay doon na sa mga maliliit na hospital. Kung mga consultation lamang o kaya magpapacheck up ang kanilang kailangan gawin.
As of today, there are 834 active cases of COVID-19 in Marikina City. Meanwhile, in San Juan City, although the occupancy rate of the San Juan Medical Center is still 50%, its quarantine facilities are almost full. In Kalinga Center, 85% of quarantine beds are now accommodated, while in San Juan National High School Annex, 65% are occupied. That is why San Juan LGU is also expected to open additional quarantine facilities to accommodate other COVID-19 patients.
Ang San Juan Medical Center ay 50% occupancy lamang. Ibig sabihin kaya pa natin mag-accommodate ng mga pasyente. Next week po ay magbubukas na po yung ating additional quarantine facilities sa mga container vans. Ito po ay sa tulong ng DPWH at ito ay makakapagdagdag po ng ating pasilidad. Hindi pa naman tayo po kinakapos sa pasilidad ngayon.
Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
Meanwhile, over 5,000 cases have been added to the COVID-19 cases in the country. The Department of Health reported 5,867 new cases today, bringing the total number of cases to 677,653. The DOH case bulletin also showed 620 new recoveries, bringing the total number of recoveries in the country to 578,461. As to the number of deaths, 20 new deaths were recorded, which means that there are now a total of 12,992 fatalities due to COVID-19. Of the 86,200 active cases, the DOH said 95.4% were mild cases, 2.3% were asymptomatic cases, 0.9% critical cases, 0.9% severe cases, and 0.49% were moderate cases. The DOH said 9 laboratories were not able to submit their data to the COVID-19 document repository system yesterday. Senators are calling to abolish the interagency task force on the management of emerging infectious diseases due to the rising COVID-19 cases in the country. However, the palace opposes it. Rosalie Cos will tell us why.
Malacanang says it is unfair to blame the interagency task force following the alarming surge of COVID-19 infections in the country. Presidential spokesperson Harry Roque insists the surge is because of the coronavirus mutation. The palace also stands firm that the government was successful in managing the COVID-19 situation until coronavirus variants enter the country.
Sa ating mga kababayan, malapit na po kasi ang eleksyon. So may ilan sa atin dahil ninanais nilang manalo sa susunod na eleksyon, talaga pong walang tigil ang pagsabi na puro palpak daw ang gobyerno. Totoo po, tumataas ngayon. Pero ang pagtaas po, among others, dahil po yan sa mga bagong variants. Unless sasabihin na naman nila na yung dapat gumawa ng paraan ng IATF para pigilin ang mutation ng mga variants. Imposible po yun dahil yan po talaga ang anyo ng mga variants.
The palace official does not think that the proposal of some senators to abolish the IATF is a constructive criticism. Roque says this is politicking amid the pandemic. He adds the task force will not be abolished because it is collaboration of various government agencies tasked to formulate policies to combat the COVID-19 crisis.
Wala pong mabubuwag because pag binuwag mong IATF, it's as if you're bubuwagin mo yung buong gobyerno kasi wala nang pong ibang buhay ang IATF kung hindi yung gobyerno mismo. Ang IATF, pinagsama-sama lang pong talino at galing ng buong gobyerno. At pagdating naman po sa bureaucracy natin, hindi naman po mga politika yang nasa DOH, nasa NEDA, nasa DOF. Lahat po yan ay mga civil service passers, the best talents that we have.
Manila Mayor Isko Moreno also does not agree with the idea to dismantle the IATF. Moreno says this does not help with the current situation. He also appeals to those who are pushing the idea to control themselves because they are not the ones on the ground who see the real situation. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
Several hospitals in Metro Manila announced that they would no longer accept COVID-19 patients for the meantime. Meanwhile, the Department of Health has started augmenting health workers in medical facilities in the National Capital Region. Asher Kadapan Jr. tells us why live. Asher?
Mega hospitals in Metro Manila, overwhelmed with the surge of COVID-19 patients, seek for more medical personnel from the Department of Health. Based on the latest data from the DOH, as of March 21, about 57% out of more than 8,200 bed allocations for COVID-19 patients in the National Capital Region are already occupied. From 159 facilities across the region, 19 hospitals have already reached its full capacity, which include Cardinal Santos Medical Center, Chinese General Hospital and Medical Center, Makati Medical Center, and Santa Ana Hospital, while 21 more hospitals are under the critical level, which has more than 85% occupancy rate, like in East Avenue Medical Center, Lung Center of the Philippines, Hospital ng Makati, Hospital ng Muntinlupa, Quirino Memorial Medical Center, and St. Luke Medical Center in Taguig and Quezon City. 27 hospitals in the metropolis were also recorded to have reached a 100% occupancy for intensive care unit or ICU bed allocations, like the UP Philippine General Hospital, where its ICU and pay ward for COVID-19 patients are already full. UPPGH spokesperson Dr. Jonas Del Rosario explained that healthcare workers from DOH's augmentation will significantly help their operation and will avoid too much exhaustion to their medical personnel. In the meantime, they have already reassigned their health workers from the non-COVID-19 facility in the hospital to help administer the increasing number of COVID-19 patients. Here's Dr. Del Rosario.
Yung iba po kasi ay na-deploy sa non-COVID nung lumiit ang aming operation sa COVID. Inalaw muna namin silang magpunta sa mga non-COVID areas ng ospital. Pero ngayon po ay dahil tumataas na ulit po ang bilang ng mga pasyenteng ina-admit ay binabalik na po namin sila.
The UPPGH have also limited their admission of non-COVID-19 patients due to lack of more medical personnel.
Yung mga non-COVID cases, yung hindi naman COVID, yun lang pong mga life-threatening at limb-threatening emergencies ang aming munang tatanggapin, no? Nagbawas din po kami ng admission sa pediatric ward dahil may mga kakulangan po kami ng mga nurses doon.
Treatment Czar Undersecretary Leopoldo Vega, however, said that the agency may already start in augmenting health workers in hospitals and referral centers. Vega further explains that the medical personnel will be deployed from hospitals with fewer number of COVID-19 cases.
Ngayon ho, kasalukuyan, nag-augment ng emergency hiring ng mga COVID referral hospitals na dagdagan ang kanilang human resource. Ginagawa na ho natin yan. At saka ito din ginawa din namin last year. So magdadagdag pa ho kami, lalo-lalo na ngayon sa surge nito.
East Avenue Medical Center, on the other hand, confirmed that the DOH has already approved to provide a budget to hire health workers to increase the capacity in their facility in correspondence with the resolution recently issued by the Interagency Task Force on the Management of Emerging Infectious Diseases, or IATF. Here's Dr. Nunez of East Avenue Medical Center.
We have requests for additional nurses, additional doctors, including paramedical personnel like medtech, respiratory tech, including support staff like admin assistant. And napagbigyan kami. Yun nga lang, we are now fast-tracking yung hiring activities namin. And ang observation namin, yung nurses, konti lang ang nag-a-apply.
That's it for tonight on my end. Back to you, Jago.
Thank you, Asher Karapan Jr., reporting live. A recent U.S. study shows that the AstraZeneca's COVID-19 vaccine is highly effective against all severities of coronavirus infections and across all age groups. Ia De Vera details to us why live. Ia?
Jago, AstraZeneca has reported that the U.S. Phase 3 trial of COVID-19 vaccine has demonstrated statistically significant vaccine efficacy at preventing symptoms, severe diseases, and hospitalizations. The analysis was based on 32,449 participants. Based on this study, AstraZeneca's vaccine has 79% efficacy at preventing symptomatic cases of COVID-19 and 100% effective at preventing severe disease and hospitalization. Also, the company reported that vaccine's efficacy is consistent across ethnicity and age, and 80% effective in participants aged 65 years and over. Manny Pangalos, Executive Vice President of Biopharmaceuticals R&D at AstraZeneca, said that the results are added as evidence to show that the vaccine is highly effective against COVID-19, and they are confident that it will serve as a protection against the virus. AstraZeneca said that they will continue to study the data gathered and is preparing to submit the said findings to the U.S. Food and Drug Administration. In parallel, the primary findings will be submitted for publication. Jago, the company is hoping for the rollout of 30 million doses and an additional 20 million doses within the first month once a U.S. emergency use authorization is granted. Jago?
Thank you, Iya De Vera, reporting live from New Zealand.
Several countries are using ivermectin, an antiparasitic drug, as a treatment against COVID-19. However, the Department of Health and Food and Drug Administration advised against using the drug for coronavirus outside clinical trials. Aiko Miguel will tell us why.
Social media posts and articles from doctors endorsing ivermectin have proliferated as governments around the world struggle with vaccination programs. Ivermectin is a drug that is often used to treat or prevent parasites in animals. Registered ivermectin products in the Philippines for human use are in topical or on the skin formulations under prescription use only, which means it cannot be taken orally but can only be applied on the human skin. Health Undersecretary Maria Rosario Vergera issued a warning to doctors who will prescribe the drug as a remedy for COVID-19.
This is really dangerous para sa ating public. So, nakikiusap po kami sa ating mga scientists, sa ating mga doktor, kasi tayo po, pag doktor tayo, pinapakinggan po tayo ng mga tao dahil alam nila na tayo naman po ay mapagkakatiwalaan when it comes to their health. But this time, because there are a lot of uncertainties, there are a lot of unknowns dito po sa mga gamot na lumalabas dahil wala pa naman po talagang proven to really address COVID-19.
The DOH says clinical trials of ivermectin in other countries did not show good results. Even the pharmaceutical company that made it doesn't recommend its use against COVID-19. The Food and Drug Administration also insists there's no study to prove its efficacy as treatment against COVID-19.
May mga clinical trials po to see the effect of ivermectin in the treatment and prevention of COVID-19. Kaya lang sa ngayon po, lahat ng mga clinical trial ay wala pa pong nagpapakita ng magandang ebidensya na para sabihin na nakakatulong siya. Wala pa po tayong nakikitang benefit sa gamot na to. Kaya hindi pa po natin siya ma-advise na panggamot for COVID-19.
The agency stressed that ivermectin has not been approved by the FDA for treatment of any viral infection. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. The Bureau of Immigration has released the names of its employees who are allegedly involved in trafficking Filipino women to Syria. A whistleblower claims that the group behind the trafficking scheme is the same mastermind behind the so-called Pastilla scam. Harleen Delgado tells us why.
Diana could not hold back her tears as she recounted before the Senate Committee on Women her harrowing experience when she was trafficked to Syria in 2017.
Nagmakaawa ako, napauwiin ako pero hindi ako pinayagan. Ayoko po kasi talaga nung magpalaglag pero halos muntik nila akong saktan at saka sampalin. Wala na akong magawa kundi inumin yung gamot na binili sa akin. Tumawag ako sa embassy ng Pilipinas pero hindi naman nila ako tinulungan. Mamamatay ako, sabi ko sa kanila, pero sabi nila hindi basta-bastang makapunta ang embassy kasi mapapahamak daw sila.
Diana, along with two other victims whose testimonies were presented during the hearing, also claimed that some immigration officers were involved in aiding their illegal exit.
Binibriefing kami, pinapadaan kami sa isang counter at yung immigration binabayaran yun. Andun ako at alam ko dahil iisa ang mga sinasabi namin doon sa Syria, ang mga kasamahan ko doon. Kaya alam ko na bayad ang immigration. Sila yung isa sa mga mukhang pera dito.
Sana yung taga-immigration bantayan ng gobyerno natin kasi yan sila mga hangal ng pera. Pinabayaran yan, may mga kontak yan sa ibang bansa, sa mga piki na mga agency. Malaking pera na matatanggap nila kaya sana mabantayan na sila at matanggal yan sila sa trabaho.
Nagpabalik pa ako sa agency ko. Sabi na ako,
Okay.
Galit na galit yung may-ari ng agency. Sabi niya, anong babalik ka? Sabi niya, anong babalik ka sa Pinas? Kaya mo bang bayaran yung 170,000? Kaya mo bang bayaran? Sabi niya, ganit. Sabi ko, ang laki naman ng babayaran ko, madam. Tapos sabi niya, bakit? Ang mahal ng binayad namin sa inyo sa immigration. Sabi niya ganun, 50,000.
Bureau of Immigration Commissioner Jaime Morenta says they have identified the 4 immigration officers who stamped the exit visas of the victims. He said a fact-finding committee has been formed to investigate the matter.
Ako po ay sa totoo lang nahihiya. I am really disappointed and frustrated about the involvement of BI personnel in these nefarious activities. However, I am thankful, Your Honor, that these people are exposed.
One of them, John Michael Angeles, has been under preventive suspension and was among the immigration officers charged by the National Bureau of Investigation last year over his involvement in the Pastilla scam. While Erwin Ortañez is the son of former Travel Control and Enforcement Unit Chief Erwin Ortañez under former Ports Chief Mark Marinas, who was the alleged mastermind of the scam. According to one of the whistleblowers, former immigration officer Alison Chong, the group behind the trafficking scheme is also the same with those linked in the Pastilla scam. He showed screenshots of group messages detailing the flight details. The certain FM in the messages is Fidel Ramos, the right hand of Marinas.
Lahat naman po kilala kung sino po yung FM sa BI, Fidel Mendoza.
Okay. Ito yung parehong Fidel Mendoza na in-identify bilang right-hand man ni Red Marinas, tama?
Tama po, Your Honor.
Alright.
Siya po yan. Siya po ang may hawak. Sila po actually ang may hawak na Sure Pastillas. Isang grupo lang din po.
The NBI vowed to coordinate with the Immigration and the Senate Committee to gather all information on the issue. A next Senate hearing is expected. Jorilyn Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Overseas Workers Welfare Administration appeals to overseas Filipino workers to reconsider or better yet, postpone their plans of coming to the Philippines. Ray Pelayo explains why.
There are now around 9,500 returning overseas Filipino workers under quarantine in hotels in Metro Manila. According to OWA Administrator Hans Leo Kakdak, that represents 85% of the total occupancy rate of quarantine hotels. The agency has sent around 1,800 OFWs to their provinces on Monday. This after the process of getting the COVID-19 results of the OFWs begin to normalize.
Nag-stabilize na po yung sitwasyon kasi noong mga huling araw lang nagkaroon ng system adjustment or breakdown yung ilang machines ng Red Cross yung nagpa-process ng specimen. Kaya may mga naantala lang sa hotels pero nagno-normalize na po ang situation.
Administrator Kakdak noted that half of the arriving OFWs went home for a vacation and not because their jobs were affected by the pandemic.
Hindi na ito yung mga problema dahil sa COVID. Nakikita natin na halos 50% pa ng mga nanumbalik ay nagbabakasyon na lamang. Ibig sabihin, nagpatuloy na yung trabaho nila sa abroad. Kasi naman sa abroad ay nag-normalize na ang sitwasyon sa maraming host countries.
In his Twitter post, the OWA official said it would be better if OFWs forgo their plans of coming home amid the surge in COVID-19 cases in the country and the increasing capacity of quarantine hotels. The agency is still seeking an additional of 9.8 billion pesos fund for the hotel accommodation and other needs of returning overseas Filipinos placed under mandatory isolation. Ray Pelayo, UNTV News and Rescue. We serve the people, we give glory to God.
Employers in the private sector were reminded to implement strict health protocols among their employees as some workplaces could be spreaders of COVID-19. Aiko Miguel details why.
The Department of Health emphasized that one major reason of COVID-19 transmission is gathering at homes and workplaces. According to the DOH, droplet transmission of COVID-19 occurs when a person is in close contact with an individual who is either talking, coughing, or sneezing, and this happens commonly at workplaces during mealtime gathering.
People are eating, etc. So this is not specific to an industry, but the act of gathering. That people put their guards down, they don't have their mask, they take it off, no, or kunyari they do not fulfill this distance requirement. So that has been what our data has been showing.
With stricter quarantine restrictions in the country, there are protocols and guidelines implemented in workplace. Face-to-face meeting and having meals together are prohibited. DTI also reminded private sectors that it is stated in the Memorandum Circular Number 85 issued by Malacanang that operational capacity in government agencies and offices are limited.
So for executive offices, 30% na lang ang ina-allow, and we encourage also the private sector to follow suit para less people in the offices, less gatherings, as long as they are able to comply, of course, with the requirements of the job at saka yung kailangan ng business or ng operations nila.
As much as possible, companies should implement alternative work arrangements and telecommuting or work-from-home scheme. According to the Department of Labor and Employment, if these are not possible, employees physically going to work should responsibly and strictly observe minimum public health standards.
Work from home if applicable. But we understand for factories or operations have to be present, and if it has to happen, we still ask them, can you limit? But if not, then the minimum public health, the physical distancing, ventilation, those have to be, of course, they should be fully compliant to that. The face shield, please lang ha. They can take it off if it's going to hinder work, but once there's interaction or once they face again, they have to put it on. The mask, that is really that should be fully complied with as well.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health plans to build more isolation facilities as the number of mild and moderate cases of COVID-19 covers majority of the total new cases reported each day. Joanna reports.
In order to properly manage our healthcare capacity, the Department of Health is coordinating with the Oplan Kalinga and local government units to intensify the isolation facilities to accommodate patients with mild and moderate cases of COVID-19. According to DOH Undersecretary and Treatment Sardio Poldo Vega, this is to avoid patients with mild and moderate cases to go directly to the hospitals. Instead, prioritize those patients with severe and critical condition amid reports that majority of the hospitals are now in their full capacity. Apart from isolation facilities, the DOH is also looking into strengthening and increasing our temporary treatment and monitoring facilities.
So kailangan matagdagan natin ang mga isolation centers at saka TTMF para mailagay itong mga mild asymptomatics kasi sila yung first line of defense, sinasabi na namin, sa bago mapunta sa hospital. Kasi pag nasa hospital magpo-concentrate na yung mga institution, sa hospital institution, sa mga moderate and severe. So ito yung unang hakbang na ginagawa namin.
Meanwhile, Yusek Vega says that they need to hire more IT and paramedical personnel to accommodate overflowing and pending calls in the One Hospital Command Center. This is amid the surge of new COVID-19 cases where a lot of queries are about hospital referrals. Yusek Vega says that recently, the One Hospital Command is receiving an average of 300 calls a day compared to 66 calls per day previously. And as more hospitals are declaring that they have reached their full capacity for COVID-19 wards and ICU beds, Yusek Vega says that they might refer other patients in Metro Manila with other medical institutions outside the National Capital Region.
Alam niyo yung hospital referral, so pwede namin ma-manage yan. Ginawa namin yan last year. Nagtutulak na kami ng coordinated care towards Region 4A and Region 3. So meron kami mga regional One Hospital Commando doon na nakapigugnayan din sa mga government retained hospitals, pati na rin ang private. So kung ganun mangyari, talagang mahihirapan tayo maghanap dito ng mga private hospitals na pangangailangan ng pasyente. Talagang i-coordinate at saka i-refer namin outside of Metro Manila kung ganun man ang mangyari po.
As of now, the DOH reported that utilization rate among COVID-19 beds in isolation is now at 60%, while occupancy among ICU beds has hit around 76%, placing the situation under moderate risk category. Joanna, UNTV News and Rescue. We serve the people, we give glory to God.
Chinese vessels remained in place at the West Philippine Sea where they were spotted weeks ago. The Armed Forces of the Philippines is now deciding the next steps to take following the latest incursion. Lea Ilagan reports why.
The Armed Forces of the Philippines confirmed there are still presence of Chinese ships at Julian Felipe Reef in the West Philippine Sea. AFP Chief of Staff Lieutenant General Cirilito Subihana said they are still working to give an accurate number of the Chinese ships in the area.
Magkaroon kami ng joint assessment with the NTS, WTS. Then, as what I said, that will dictate our subsequent course of action.
The National Task Force for the West Philippine Sea or NTF-WPS said the ships are believed to be manned by Chinese maritime militia personnel. But the Chinese embassy in the Philippines said in a statement on Monday, there is no Chinese maritime militia as alleged. The embassy said that those are only fishing vessels taking shelter due to rough sea condition. The Philippines has filed a diplomatic protest against China following the latest incursion. AFP Chief of Staff Subihana said that the military will coordinate with the NTF-WPS to decide what next steps to take with a priority to protect our sovereignty.
Mandate namin yung Bureau of Territory. So we really oppose any act of incursion sa ating territorial waters, no? Including our exclusive economic zone.
President Rodrigo Duterte is scheduled to talk to Chinese ambassador to the Philippines, Wang Zilian. According to presidential spokesperson Harry Roque, the chief executive is confident that the tension between the Philippines and China will be resolved regarding the issue. Lea Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
A maritime law expert says that the presence of Chinese ships in Philippine waters is a violation of the country's sovereign rights. Dante Amento tells us why.
Julian Felipe Reef, a boomerang-shaped and shallow coral region, is about 175 nautical miles in the province of Palawan. This is within the Philippines' exclusive economic zone, and the country should enjoy the exclusive right of its resources. Thus, UP Institute for Maritime Affairs and Law of the Sea Director Attorney J. Batongbakal says the mere presence of Chinese vessels in the area violates our national law and sovereign right. And the ruling by the Hague Tribunal that voided the claims of China in the disputed territory in the West Philippine Sea.
Kasi the mere presence of a foreign fishing vessel sa ating waters ay ano na yan, poaching na yan, no? Crimen na yan. Pangalawa, sa international law din, alam naman natin, no, nanalo tayo dun sa kaso sa The Hague. Yung ganyang pagpapatuloy ng China ng mga fishing operations nila sa loob ng ating EEZ ay isang pagpapatuloy din ng paglabag ng ating mga karapatan under international law.
Batongbakal adds it will affect the local fisherfolk's security and a source of living for the area is a known fishing ground.
Mag-i-impact yan sigurado sa ating fishermen, no? Nababawasan na naman ang kanilang mga fishing ground. So dapat kasama yan dun sa mga consideration natin. Yan ang issues natin of concern talaga, no? Kung hindi mag-iingat ang gobyerno, baka maging katulad ng Scarborough Shoal na napaalis tayo sa isang lugar ng China simply because lagi na rin silang nandun.
Batongbakal also stresses the country through the Defense Department must monitor the activity and the presence of those vessels continuously but in a diplomatic way.
Kung sakaling gamitan natin ng dahas yan, hindi tayo magiging tama doon dahil wala silang ginagawa, nakatayo lang doon. Pero yung mere presence nga nila is a violation of law. So kung ang China ay isang responsableng bansa, dapat i-withdraw niya yung mga vessels na yan sa ating exclusive economic zone.
Meanwhile, Justice Secretary Minardo Guevara says that there is a need for more specific information on the issue before making a legal conclusion, especially if it involves a foreign government. And there is still no verified information yet if those foreign vessels conduct poaching within our exclusive economic zone and let the Foreign Department to handle it. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
A shooting at a Colorado supermarket killed 10 people, including a police officer who was first to respond on the scene. Authorities are still investigating the motive for the deadly shooting. Armin Sinca reports.
10 people were killed on Monday after a shooting at the King supermarket in Colorado, including a police officer of Boulder Police Department. According to Police Chief Mary Servold, the slain officer was identified as 51-year-old Eric Talley, who has been with the Boulder Police since 2010. He went to the store after a call about a shooting and a man carrying a rifle. Police arrested the suspect but did not disclose his name or any details about the shooting at a news conference. Identities of the other 9 victims were not disclosed Monday night, as police were still notifying their family members. Officers brought out of the store a shirtless man with blood flowing down his feet while handcuffed, but authorities did not say if he was the suspect. Some front windows of the store were broken, while law enforcement vehicles and officers, including SWAT teams and at least 3 helicopters, were surrounding outside. At the request of the police, the Federal Bureau of Investigation is also assisting in the investigation of this incident. The King Supers meanwhile says it will continue to work with local law enforcement and their store will remain closed during the police investigation. Armin Sinca, UNTV News and Rescue USA. We serve the people, we give glory to God.
Another 15,000 New South Wales residents have been put on high alert as to catastrophic weather front roll across the state. Marvy Delfin will give us the details live. Yes, Marvy, what is the situation over there?
William, even with blue skies on the horizon, the New South Wales flood emergency continues, and state emergency service crews race to deliver food and medical supplies to cut-off communities. More evacuation orders have also been issued for residents that live around the Hawkesbury-Nepean River system, especially in low-lying areas. New South Wales Premier Gladys Berejiklian estimated around 15,000 people would be evacuated today. The northwest of the state were lashed by heavy rains overnight, with some areas receiving 4 times their monthly rainfall average in 24 hours. Now the severe weather system moving over the continent has already cleared the western part of New South Wales. However, flooding will continue to wreak havoc and might not dissipate until the weekend. A number of towns across the state have been isolated for days, some without fresh water or power. Roads have been cut off, hundreds of homes inundated, and around 200 schools shut. Back to you, William.
Yes, thank you very much, Marvy Delfin reporting live.
The World Health Organization described the trend of COVID-19 cases and deaths worrying, as both showed an increase for this week. Charisse Dombowen will tell us why live. Yes, Charisse.
Carlene, after 6 weeks of decrease in COVID-19 deaths, this week showed a slight increase across the world, which was described as worrying sign by Maria van Kerkhove, the World Health Organization's COVID-19 technical lead, on yesterday's global COVID-19 press conference of WHO. Another worrying trend is the continuous increase in COVID-19 transmission for 5 weeks now in 4 of 5 WHO regions, with 8% increase last week.
In Europe, that is 12%, and that's driven by several countries across the European region, and a lot of that is driven by the B117 variant that was first identified in the UK that is now starting to circulate in many countries in the eastern part of Europe. We've seen an increase of cases of 49% in our Southeast Asia region, which is largely driven by increase in cases in India and in a number of other countries there. In our Eastern to Mediterranean region, we've seen an increase of 8%. And in our Western Pacific region, we've seen an increase in cases of 29%, largely driven by increase in cases in the Philippines and Papua New Guinea.
The COVID-19 technical lead also added that there are a very dangerous combination of factors that contribute to the increase of transmission, which are difficulty to comply with proven control measures, uneven and inequitable vaccination distribution, and increased transmission of COVID-19 variants. The WHO also advised to continue to adhere to the individual level measures that keep us and our loved ones safe while COVID-19 vaccinations are rolling out. Harleen?
Thank you, Charis Zamboan, reporting live. The Department of Health, or DOH, said the recent reports of non-healthcare workers being inoculated have already been referred to the Departments of Interior and Local Government, or DILG. Mayor Alfred Romualdez of Tacloban City, Leyte, was injected with China's Sinovac on Monday, while Mayor Elanito Peña of Mindanilla, Cebu, received the vaccine from the British-Swedish drug maker AstraZeneca today. DOH Disease Prevention and Control Bureau head Dr. Gika Hao warned administrators of COVID-19 vaccination sites against allowing those who jump the line in the prioritization list set by the national government. Hao says that the succeeding vaccine supply from COVAX facility might be jeopardized if the prioritization framework on vaccination will not be followed.
Not doing such will risk us not receiving future supplies, no, not only from the COVAX facility but even in our other engagements, no, it is all part of those agreements that we have to follow the national vaccine deployment plan, and this is really because there is a global supply shortage.
DILG Undersecretary Epimakuden Singh III said they will send show-cause orders against the mayors. And those are the reasons behind the news, March 23, 2021. I am Harleen Delgado.
Old Emangelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.